Ever open a Med-Surg chapter, see all the bold terms and feel lost before reading the first line? KeyTerms are just a small part of the work, but they unlock the rest. If you learn term first, the rest becomes easier to absorb. Every joint in the body has a hidden map. It shows how bones connect, how cartilage cushions, how tendons and ligaments move. When nurses learn to read this map, we understand where pain starts and how the body works beneath the surface. Now let's explore the key terms for the hidden map inside every joint. Think of each joint as a map made of bones, cartilage, ligaments, and tendons. When we understand those key terms, we can see how that map turns into a motion. And it's good for report and patient teaching. We are in chapter 52 from Davis Advantage Medical Surgical for Nursing. Chapter 52 Assessment of Musculoskeletal Function. So, key terms. The first term is amphiarthrosis, which means it's a joint that allows slight movement. Think about amphi means both sides, limited movement on both sides. Next is articular cartilage, meaning smooth tissue covering ends of bones in joints. Articulate, it's like a joint. Cartilage cushions joints. Next, automaticity. It's the ability of muscle cells to contract without neutral input. Auto means self. Muscles act on its own. Bursa, it's a fluid-filled sac that reduces friction in joints. Bursa is like a cushion, like a purse that softens a pressure. Cartilage, firm, flexible tissue in joints, and nose. So cartilage is like a cushion, protects the bone ends. Collagen, protein providing strength and structure to connective tissue. Colla means like a glue, holds tissue together. So colla means like a glue. Diaphysis, it's the shaft or central part of a long bone. Dia means truth, like, and then physis, growth. So dia is throughout, and physis, it's the growth. Diaphoresis, it's fairly movable joint like shoulder or knee. Dia, we said through. It's like a full motion. Down gears humped. It's like keep poses seen in older adults due to osteoporosis. So hump, it's like hunched back since in aging spine. Endosteum, it's a membrane lining the inner bone cavity. Endo, it's the inside, lines marrow captivity. Scrolling down. Oh, I went too fast. Epiphyseal line. It's a remnant of growth plate in adult bones. Line, it's like where growth used to happen. Epiphyseal plate is the growth plate of cartilage in children's bones. So plate is place of growth in young bones. Epiphysis, it's end of a long bone. Epi means like upon, ends of bone. Fascia, it's a connective tissue surrounding muscle. So fascia is like a wrap or band. So a thin shift of fibrous tissue enclosing a muscle or organ. Then fasciculi, it's a small bundle or cluster of nerve fibers or muscle fibers. So it's a bundles of muscle fibers. Fascia is like bundle of sticks, the fibers. Goniometer, so it's an instrument used to measure the angle of a joint. So it's a tool to measure the joint angles. Gonia means angle and meter means measure. Hematopoietic is the process of forming blood cells which occurs in the red blood marrow. So it's related to blood cell formation. Hema means blood, poiesis it's a making. Hyaline cartilage is translucent cartilage at the joint surface. So it's a type of cartilage with a smooth, glossy appearance found in joints, nose, and trachea. So hyaline, it's like glossy, smooth joint cartilage. Ligaments connects bone to bone. So it's a strong fibrous connective tissue that connects bones to other bones. So L, it's like link bones together. Non-synovial joint, it's a joint that lacks synovial cavity and is held together by fibrous connective tissue cartilage. So it's a joint without the fluid filled capsule. Non is like no non-synovial fluid. It's nothing. Osteoblast, cells that build new bone tissue. So cells that build the bone. And blast means builder. Osteoclast, cells that break down bone tissue. And class means like crush. Osteoporosis, It's a medical condition in which the bones become brittle and fragile from loss of tissue. So it's a loss of bone mass leading to fragile bones. So porous bones means holes in. So this it's osteo, it's bone, and then porous, it's holes. Paresthesia, it's a sensation of tingling, prickling, or numbness. So it's abnormal sensation like tingling. So para, it's abnormal. Esthesia, it's the feeling. A little bit to scroll down. Periosteum. So it's a dense layer of vascular connective tissue and enveloping the bones except the surface of the joint. So it's a membrane covering the other bone surface. So it's around, osteum, it's the bone. Sarcopenia is the degenerative loss of skeletal muscle mass, quality, and strength associated with aging. So it's a loss of muscle mass with aging. So sarco is the muscle, penia is the loss. Penia is like low, like below of something. Sesamoid bones is a small bones embedded in the tendon, such as at the patella. So it's the small bones. Sesame seed is like a shape bones. Synarthrosis, it's a immovable joint. So like skull sutures. So seeing the CY here and N, swine, it's like together, no movement. The synovial fluid, it's a lubrificant fluid in movable joints. And yeah, it's like synovial is like a slipper fluid for joint. Similarly, a freely movable joint characterized by synovial cavity, articular cartilage, and synovial fluid. So it's a freely movable joint with fluid capsule. So it's then tendon. It's a flexible but inelastic cord of strong fibrous collagen tissue attaching a muscle to a bone. So connects muscle to bone. So think about T ties muscle to bone. Trabeculae, it's small bony spiculae or plates that form the spongy bony tissue. So it's lattice-like bone tissue inside spongy bone. So trabecula means like beams or meshwork. The last one, viscoelastic. So it's a property of a material that has both viscose fluid-like and elastic solid-like characteristics. It's a tissue with bone fluid and elastic properties. So visco means fluid, and elastic it's stretchy, elastic. So visco it's fluid, elastic it's stretchy. So, which term always trips you? Drop it below. And here is the end of chapter. Now you have seen that the musculoskeletal system really does hold a hidden map, where bones, joints, and connective tissue shows us exactly how the body moves and where it hurts. Terms like epiphysis, cartilage, synovial joint, bursae, and ligaments form the topography of that map. Every joint hides a map made of bones, cartilage, ligaments, tendons, and muscle working together to create the movement. Once you learn to read that map, you stop guessing and start assessing like a nurse. Those terms, once you understand them, you will not confuse them, and it's good for reports and for patient teaching. I hope you enjoy this little video, and see you in the outline. Thank you for watching and being here with me, and see you next time. Bye for now.